Hello, Dr. Hoque here. In this video, I will share with you what are the 5 very important tips that you must know if you are starting your internship. This internship could be any medicine, pediatrics, or surgical specialties. Remember, there are very common principles you need to know and follow during your internship, regardless of your specialty. If you are new to this video, welcome. If you are returning back, thank you so much for joining me today. I am an associate professor of medicine, currently practicing in the US. So let's focus on which 5 things you must know during your internship. First, after you go to hospital, before you see your patients in the US, you must have to do the chart review, the pre-rounding. So for that, you are entering your EMR, reviewing all the labs, need to know is there any concerning events overnight, how is the labs are doing, how is patient's vital. You must know that. So after you pre-round, after you chart review and have some labs, maybe if you have, for example, hemoglobin is less than 7, you need to know when to transfuse. If the WBC count is much higher or any change in the lab, you need to address that. So after chart review, now you need to go and see the patient. My second tips will be that when you are going to see your patient, address yourself with doctor, because although you are intern, you are a physician, right? You are maybe trainee, but you are physician, and it is very important to introduce yourself every day to the patient, because they see a lot of physicians. Most of the time, the research showed that patients forget. So, not before you enter the room, introduce yourself with your last name, and also tell them that okay, you are intern taking care of that patient. Make sure when you are talking to patient, if there is any family member in the US, particularly if you are an international medical graduate or IMG, I want you to remind you that ask the patient's permission first before talking about their health in front of any family member. If they give you the information on first day, that is fine to continue if there is same family member on the next day about talking with their health. If there is a new family member, ask their permission again. So after you talk to the patient, you know what is going on, and then you will talk with your resident, and then you will present your case about your patient to the attending physician. So if you have any question, always remember to talk to your resident first, because the tips number 3 is medicine is still very hierarchy. And as an intern, you are directly reporting to your resident, meaning your resident is there to guide you, to help you, to answer any of questions you may have. If you feel that, okay, your patients need a particular consultation, maybe cardiology, rheumatology, talk to your resident. Particularly, I will recommend it for the first 6 months. Talk to your resident and just discuss if this is the right plan or not. And after you talk to your resident, after you have the plan, and when you are presenting about your patient to the attending physician, always bring out what is your assessment? What is the biggest plan for that day? What is your treatment plan? Is the patient going to be discharged? Okay, what is your tentative discharge plan? If this patient is going to stay, how many more days? What are the barriers the discharge? Always train yourself to think that what are the things you need to complete? What are the barriers you need to address before you can ensure patient can be discharged safely? This is very important. So the number 4th advice I will give you, that understand the prioritization. And this prioritization could be in a different way as an intern. For example, you need to prioritize that, okay, which patients you will see first. Maybe you have 8 patients. You cannot see all at the same time, right? After you review the labs, if there is something like acute, any lab change, anything significant happened for any patient, or maybe if a patient is sick, you need to prioritize to see that patient first. The prioritization is also very important. For example, you need to assess that, okay, if there is any acute thing going on, you need to prioritize and assess that does this patient need to go to a step down or does this patient need to go to ICU? Remember, hospital, this is a very acute care setting. So prioritization, knowing the right timing when the patient need higher level of care, it is very important. And do not take all the stress on yourself because you are a trainee. If you have any questions anytime, talk to your resident about it. Regardless, make sure if there is any changes in your patients, you know what is the right step to take. Maybe need to call a consult, maybe talk to your resident or attending physician. Maybe you need to evaluate that does this patient need to call rapid response or does this patient need to go to ICU. Prioritization about patient, prioritization about work is very important as an intern. And now the fifth tips, I will emphasize that you are pre-charting what we talked. You are seeing patients, talking with family, presenting the case. That's very good. The number fifth, which is very important, that whatever you are doing for your patient, it is also very important to document it. In North America, if it is not documented, it did not happen. That is one of the lessons I have learned from my mentor. So that being said, on the first day of your rotation, if you are just starting your internship, ask your resident to share the templates for history and physical, templates for progress note, discharge summary, rapid response note, family communication note. Ask your resident to share all those templates because regardless what you are doing, how many works you are doing, you need to document appropriately and with all the right information. So take those templates and be familiar with your electronic medical record because as an intern, along with seeing the patient, talking with patient's family, talking with all the team members, you will spend a lot of time documenting in the electronic medical record. I hope you find these 5 tips helpful. Internship, it's maybe a lot of work at the same time. You have worked hard to get this internship. So bottom line is also enjoying this time because soon this 1 year will be passed. You will be a senior resident and then you will train a new intern. So focus on your skill, enjoy the time. That is very important. If you like this video, please put a thumbs up, share this video with your friends, and please subscribe to this channel because your support means a lot to me and it gives me motivation to create more educational videos for you. I wish you all the best. Let me know what other tips you are following so that we can exchange our thoughts because this is a channel we share our knowledge, we share our thoughts. I will see you in the next video and until then take care and enjoy your training.